Hey guys, Dr. Shahid here, and in this video, we're going to discuss case selection based on levels of difficulty as described by the AAE, which again is the American Association of Endodontists. So there are three difficulty levels. We have low, moderate, and high, and these are based on the preoperative condition of the case and any associated risk factors. And risk factors, to be honest guys, it can even be things that are not controllable by the dentist, something like limited mouth opening. So low difficulty implies an uncomplicated case with routine complexity and only low difficulty factors. So for example, a tooth with slight inclination and rotation, maybe less than 10 degrees, or with vital structures that are more than 5 millimeters away from the apex. So these cases have a predictable treatment outcome and should be obtainable by a competent practitioner and even one with limited experience. Moderate difficulty implies, on the other hand, a complicated case that has one or two moderate difficulty factors. So again, for example, we have a tooth with moderate inclination and rotation. This is between 10 to 30 degrees, limited mouth opening, or with vital structures 3 to 5 millimeters from the apex. For cases such as this, achieving a predictable outcome may be challenging, even for a competent, experienced practitioner. Lastly, we have high difficulty cases which are exceptionally complicated and have 3 or more moderate difficulty factors, or at least one in the high difficulty category. For example, this is a tooth with extreme inclination and rotation, more than 30 degrees, complicated root canal anatomy, maybe we have a presence of a full coverage restoration, or maybe we have vital structures less than 3 millimeters away from the apex. In these cases, achieving a predictable outcome may be challenging for even the most experienced practitioner with an extensive history of favorable outcomes. But guys, the takeaway here for the dental board exam is to always remember, if the level of difficulty exceeds your experience and comfort, consider referral to an endodontist. Okay guys, let's reinforce everything we just learned with a practice problem. We have a 47-year-old female. She is here for a root canal treatment. She is type 2 diabetic and is taking metformin. And current findings include a 20-degree rotation on the mandibular right first molar, which is what she is planning to have root canal treated today. Okay, so the question is, what is the estimated level of difficulty of this case? Pause the video, should be a pretty easy one. The answer is B, moderate difficulty. And there are a couple of things that should have clued us into this being moderate difficulty. The first being the tooth type. This is a first molar. Posterior teeth are certainly more difficult to handle from a root canal treatment perspective than our anterior teeth. But the most important factor is the rotation here. We have moderate rotation between 10 to 30 degrees. Remember guys, if we have a rotation of less than 10 degrees, that puts us in the low difficulty category. And anything more than 30 degrees certainly puts us in the high difficulty category. And just a side note, the type 2 diabetes in this case doesn't really help us place this patient into a difficulty category. All right, guys, that's it for this video. See you next time.